One thing that we said earlier is that we're going to be talking about threats. What are these threats, Joker?
A lot. Viral threats.
Okay.
They call it. The International Research Center of Excellence at the Institute of Human Virology in Nigeria has just concluded a 2-day symposium themed Combating Viral Threats Through Public Health Response and Research. And this is aimed at advancing innovative research for improved health outcomes.
Okay. So our guest this morning are Professor Lashley Abimku, who is Executive Director, International Research Center of Excellence and Institute of Human Virology in Nigeria, along with Dr. Aderonke Agbaje, Director of Program Special Projects, Institute of Human Virology, Nigeria. Both of them, as you can see, are in our Abuja studio. Good morning, and thank you for joining us this morning.
Good morning.
Good morning, and thanks for having us.
All right, let me begin with you, Prof. Tell us a bit about your institute, particularly the Research Center. What are some of your significant research activities, particularly in addressing Nigeria's healthcare challenges?
Yeah. Thanks for that question. The Institute of Human Virology in Nigeria's main mandate is to provide high-quality service that is equitable and accessible by all communities in Nigeria. While doing that, its focus is also on building capacity for other younger Nigerians, and also having informed services that is improved as a result of research that is happening within the Institute. So the International Research Center of Excellence really has the focus of ensuring that whatever services we're providing to improve the lives of Nigerians is informed by research and activities that we do, so that it's optimized and we know what goes into it to be able to scale up. Apart from services, the research we do also is in anticipation of what is circling around the nation that is a threat to the Nigerian people. What activities are Nigerians doing themselves to put themselves at risk? So all of that are important information that we conduct at the International Research Center of Excellence at IHVN to make sure that we provide services that addresses the health challenges within the country, but that is also equitable, of high standard, and that builds capacity as well.
Okay. A quick one to you, Dr. Agbaje. You have organized this annual symposium since, 2023? So why is this particular one that important, particularly in addressing public health concerns?
So thank you very much. This particular symposium focuses on, or focused basically on, current viral threats of public health importance in Nigeria, and how we build surveillance around it, how we bring evidence to combat those viral threats, how we build evidence as to the best approach to provide treatment and prevention for Nigerians. So basically, it brought together researchers, early career scientists. It brought both international and local public health experts, as well as policymakers, to look at the current viral threats that we're facing in the country.
Now, if we talk about addressing viral threats, which we usually say that it's everyone's business, what should researchers, public health experts, policymakers, and people of various communities consider for an effective response to viral threats such as the ones that are more endemic here, which I'm sure that that's what is the focus, like Lassa fever, dengue fever, and Mpox? That's to you, Dr. Agbaje.
Okay, thank you very much. It's really important for, so I'll start with researchers, as you said, as they look at the evidence, to involve the end users of the knowledge that will come out of the research early on, the communities, the patients, and very importantly, the policymakers, right from the design of the research, as we do at the International Research Center of Excellence. I'm sure Prof will talk about that a bit more. So right from the design up till the time of the knowledge dissemination, the evidence dissemination, all critical stakeholders have to be involved. Now for the communities, it's important to make sure that we engage them, give them the right information that they need. So as the policymakers roll out the policies, the aspect of communication, appropriate communication in languages that are well understood by those that are impacted is very, very important and needs to be factored in. Also, and as the evidence comes out as well, it needs to be translated in the simplest form. And then for us, the citizens and the communities, we should make sure that we transmit information that is coming from credible sources, like the Federal Ministry of Health, the NCDC, the World Health Organization, and we are not propagating rumors about these illnesses. Also, we should have a part in surveillance. So the communities are very critical in surveillance because that is where the symptoms start, right? So early reportage of symptoms. Once you have symptoms that are similar to what the Ministry of Health has said about these viral illnesses, make sure you go to the nearest health center and report. We should avoid self-medication. And also, we have the policymakers and the government providing infrastructure to attend to the symptoms for diagnosis, early diagnosis, and also for the communities when the treatment options are given, the vaccines are provided. Let us make it a point of personal and community responsibility to access these vaccines, yellow fever vaccines, the COVID vaccines, etc. I'll hand over to Prof to talk about the research bit of it, which is really critical.
No, absolutely. Thanks, Dr. Abaji. So for instance, in your question, you gave examples of things like Lassa fever and Mpox. So Lassa, we've had outbreaks of Lassa in the country for the last 11 years. And we know that during the dry season, it kind of escalates. So why do we continue to have this problem? We know that it is endemic. It is a risk to our population. So that's why in the work that we do, some of our policymakers says, well, you've been conducting this research. We don't know anything about it. You don't expect your policymakers to go and read publications that you've published. There are certain lines of communication for different groups. So one of the reasons we've had symposiums, scientific symposiums like the one that we've had, and we have everybody, the community and the policies makers available, is to share our findings from what we're seeing. For instance, what is it that puts people at risk to Lassa fever over and over again? You know, what is it that the habits of the rat that transmits the disease that continues to happen? The virus itself, has it mutated? Is it more pathogenic? Should we really look at whether the vaccines that are being put together is appropriate for the viruses that are circulating? What about the humans in terms of bringing in social sciences? What are we doing as humans that is putting us at risk? What do we do with our foods? Do we expose it to the urine of the rats that's continuing? How can we educate? Are we using the appropriate language, like Dr. Abaji said, when we go to the rural areas and try and talk about some of the risks that we as humans do and put us at risk? We do a lot of deforestation. That affects us. We go to an environment that is new to us and new to our immune system. What are we exposing ourselves to? So, for instance, some of the activities that we do in research is what we call surveillance. We look at different aspects within our environment, whether we look at new vectors or we look at wastewater system, for instance. What pathogens are we seeing that is probably re-emerging or new to within the environment? So that in that case, we're able to share our findings with the Nigerian Centers for Disease Control, for instance, and say, look, from the surveillance that we're doing on wastewater, we're seeing an increase in dengue virus, for instance. Maybe we would have detected SARS-CoV-2 before it hits everybody during the COVID. And then, now that we have the experience from having gone through a pandemic, like COVID, how have human beings responded to some of the interventions, so to some of the lockdown, to wearing masks, to doing social distances, to taking the vaccine that is freely available? So all of that information is absolutely critical in terms of what we call pandemic preparedness, outbreak preparedness, preparing ourselves for viral threats that continue to happen and are bound to happen. So we share some of those information based on high quality data that will help us as a nation to prepare better, to reduce our risk that would, from all the activities that we do that exposes us, to make sure that we are using the appropriate language. So having the right policies, sharing our findings, not just in manuscripts that we publish, but in meetings like we did with the scientific symposium and discussing with the community and policymakers, is absolutely critical in ensuring that our population is protected for endemics like Lassa, but more importantly, prepared also for possible outbreaks that would happen.
And I was going to interject you earlier. The challenge has never been the outcomes. The challenge has also always been transmitting research, data, information into the lives of the Nigerian. Now, how do we close the gap, Prof, between research, its findings, and communication of those findings to the public, to the point of ownership, on the one hand? On the other hand, research produces results that if we use them, we'll be less dependent on imported products and more dependent on homegrown stuff. Third, research will probably help us to close the gap between the fact that we know what is the cause of dengue fever or Lassa fever, for instance, and how to make sure it is not an annual sacrifice or offering or activity that we have to suffer. How do we close those gaps, Prof, between research and execution? You have 1 minute, ma'am.
Okay, you brought very important factor. Everything that you have pointed out is important. So from the very beginning, we must involve our communities in the research that we do. Don't assume that they don't understand research. Co-create your research questions with the community. We're concerned about this problem, and what are you observing? So they're going to share some of that with you. And then the second thing also that you pointed out is, like we already mentioned, through scientific symposiums and all of that, share our findings. But outside of that, really make sure we continue engaging our policymakers so that all of those activities that should happen on a continuous basis, not just after the scientific meeting and it's done and then it's forgotten, on a continuous basis. And that's why the community must own it, because government can't be there all the time doing what we need to do to put ourselves at less risk. So the community must own it, and the community owns it when you co-create with them. And then you discuss your findings and then discuss what your interventions has done and how we can move forward. So I think the point you bring up in terms of owning the issue and owning the interventions and owning the successes is something we all as the community must do. And really on a consistent level, not just a one-time event.
We can only hope, Prof, that at the end of the day, we not only close the gaps, but we close it sustainably, and we are able to spread it to every sector of our lives. Thank you so much for your time this morning. Professor Alashle Abimiku is Executive Director, International Research Center of Excellence, Institute of Human Virology in Nigeria, along with Dr. Aderonke Agbaje, Director of Program Special Projects of the Institute of Human Virology, Nigeria. Thank you for joining us, both of you.
Thank you.